the Dominican Republic Medical Partnership, a partner ministry of Village Church. We believe that access to quality health care is not limited to our nation's borders, but by our own sense of justice and compassion. Our mission is to improve the health and well-being of underserved populations of the Dominican Republic and promote sustainable healthcare efforts through partnerships. The southeastern region of the Dominican Republic is characterized by vast sugarcane fields which attract Haitian workers and their families from the western side of the island. The field workers and their families reside in villages called bates. Village Church began sending youth group mission trips to this area in the early 1990s. Observing the lack of basic health care in the bates near La Romana, medical professionals were soon gathered by school nurse Bev Timmons as a corps of volunteers to embark upon the first medical mission trip. That first medical mission trip soon developed into multiple yearly trips staffed by medical professionals including surgeons and other specialists. In addition, the Malnutrition Prevention Program and others were developed by the DR Task Force of Village Church. In 2007, the organization officially became the Dominican Republic Medical Partnership. As the name suggests, we cultivate collaboration with various organizations, which include the Good Samaritan Hospital in La Romana. This is where all Drmp surgical teams work in conjunction with surgeons there at the hospital. They pass along training and best practices, and all surgeries occur in the Good Samaritan's operating rooms. Another partner is Light a Candle Foundation, which began in 2008 as a project to bring health education and hope to families in the bates. Light a Candle's work now includes health presentations and workshops to small groups and communities, health promotion efforts with children and families, and locally produced health education videos. Also, Drmp collaborates with several other U.S. and Dominican partners. And now about the work of Drmp. Drmp sends 4 teams of either medical or surgical providers to southeastern Dominican Republic each year. In addition, Drmp sponsors ongoing hypertension clinics in the summer, which are staffed by Dominican doctors. All Drmp medical teams visit the same 6 bates for continuity of care and to maximize the impact of health interventions. Teams may see between 500 and 1,000 patients each week. Last year, our medical teams saw more than 2,500 patients in the 3 weeks combined that they were in the Dominican Republic. The mobile clinics staffed by Drmp medical teams consist of basic medical evaluation and treatment, hypertension screening and treatment, family planning, distribution of parasite medication for children, and health education stations. Our surgical teams work at the Good Samaritan Hospital, performing life-changing surgeries for those who could not otherwise afford such care. Our surgery teams include an orthopedic team, a team for tubal ligations, a pediatric and general surgery team. Last year, our 3 surgical teams performed more than 185 surgeries in the 3 weeks combined that they were in the DR. Drmp was a catalyst in establishing ongoing health programs that have now assumed Dominican management. The Health Promoter Program began as a Drmp-funded mission to support a healthcare presence within poor villages. With training, some supplies, and a small stipend, many villages now have their own health promoter to assist with family planning and general health counseling. The program is now managed by the Good Samaritan Hospital. Current, ongoing Drmp programs that are operated in collaboration with Dominican organizations. The first being the Hypertension Program. Because of the designated bate concept, patients are seen by consecutive medical teams, allowing for consistent monitoring, medication, follow-up, and data collection. Currently, approximately 550 patients are actively followed by this program. Their blood pressure is monitored and they receive medication every 3 months by either a Drmp or Dominican team. They are given medication labeled with a red dot for easy identification. Since 2012, 40% of DRMP Bate patients with hypertension have reached healthy levels. This is a notably good result for this patient population. Another ongoing program is the Child Health Promotion Program. This is carried out by Light a Candle with DRMP financial and technical support. Light a Candle visits the 6 designated Bates and other locations twice weekly, where they weigh, measure, and assess growth of children ages newborn to 5 years according to World Health Organization growth standards. They also provide the community with general nutrition education and counsel parents of children with growth problems. For children with severe problems, special assistance is offered. Since 2012, approximately 1,200 children have been evaluated in 33 Bates. Approximately 30% of the children identified with poor health and growth have demonstrated measurable improvement as a result of this program. We have recently expanded our efforts to work more towards sustainable health care, empowering our Haitian and Dominican friends through health education to create for themselves a brighter future. In addition, the DRMP education stations allow for the involvement of American volunteers who have non-medical backgrounds, as well as the village church youth who participated with these stations this spring. We currently operate 2 education stations, which function as independent modules of the mobile clinics. The first station introduced was the nutrition station, which targets young adults who are considered either current or prospective parents. This station teaches about balanced nutrition for meal preparation. 213 participants were evaluated. Before the activity, pre-test scores demonstrated 37% correct answers, but after participating in the educational activity, post-test scores showed 90% correct answers. Multiplying Light is another educational program carried out by Light a Candle with DRMP support. This program educates and empowers young adults to be health leaders in their communities by influencing the health practices in their homes and the Bate. Much has evolved about DRMP work in the past 20 years. Though some aspects of health have improved in the Bates, grave issues remain, as does DRMP's commitment to empowering the people to healthier lives and brighter futures.